right, hello and honors program. I'm Riley. I'm here with Dr. Scott Jorgensen.
So kind of just in general, can you go, and you talked about this when we were on the Zoom and last Friday, but could you kind of go over how COVID has affected your job?
I'll try to be succinct about it. Everybody knows COVID. We hear about it all the time now, every day. And this has been, as they say, a moving target since day one. So every day the rules change. And you would think that me as a doctor, like be busy and all that sort of thing. Well, as an outpatient internal medicine practice, we closed down our clinic. I would work though a full day in the office and get 1,000 phone calls, and I would triage these calls and try to get people calm down or to get them to the right place. If I had one person with COVID though that would come into the office, that would contaminate the entire office and shut down our clinic and shut the doors for 2 weeks. So we do all the screening that they talk about, and we're still doing it. They get screened for temps every day, or every time they come. We got masks and that sort of thing. Mm-hmm. So anyway, it shut down my practice to a slow process for sure. Now, I was doing some telehealth visits with people, Zoom, Google Duo, or FaceTime. FaceTime I get, the other ones I had to figure out. A rare patient would have to come in because of whatever it was that they just had to be seen.
Yeah.
And so we'd have to go through a big gymnastics to get them into the office and make them safe, and they weren't exposed to other people too. Mm-hmm. So that would take place, but they'd be very intermittent, and we'd have to spread them out. And there's 3 internal medicine doctors. Well, actually, there's 5 internal medicine doctors here, and usually 3 at a time, or maybe 4 that are working at a time. So then you have to spread them out even more. So that was difficult, but I felt like I was working as much, but yet twiddling my thumbs too, because I was doing telehealth visits, which is fun because then I'm at least dealing with the patient, right?
Right.
But I was triaging more people than anything else. Mm-hmm. And so that became a lot of what we did. Now we just this week started ramping up again. And by ramping up, I mean, now we're at 25, 30, 40% of capabilities. And it'll go up from there, hopefully in the next week or 10 days. Mm-hmm. But again, being very careful about who comes in, and people with, some maybe a cancer process and they're in chemotherapy. It's like we're keeping them far away from here. The stay-at-home thing is absolutely crucial for people like that. But we're also trying to get people who need, if you're hypertensive diabetic and you're in your 80s and you're not being checked and followed and things are getting out of whack, you're going to put yourself at risk. And I had a couple COVID patients, by the way, who ended up in the hospital and ICU, and both have gone home so far. So that's good. And and I'm sure there's many others who've had it, who we didn't prove that they had it because we weren't testing back at that time. And you reflect back and it's like, oh, I'm sure that they had the coronavirus based on their symptoms. Excuse me. But we also have some of these people coming in. There's, we had one person who was really sick with low back pain and some urinary symptoms, but they wouldn't come in and they didn't want to go to the emergency room because they were afraid of COVID, but yet they were very sick. So you could argue that was, and ended up in the hospital and in intensive care for a while, getting taken care of because they got almost too sick. There was a delay in treatment because the person was afraid to come in, and I completely get it. I kept thinking, well, I'll be better tomorrow. Mm-hmm. But anyway, it's a long-winded way of not being succinct, but to say that this has really affected our entire practice. My general surgeon partners, mm-hmm. all their elective cases absolutely stopped. So no hernias, elective gallbladders, skin issues, surgeries, that's all been postponed. Total joints, we do not have orthopedic surgeons in my practice, but mm-hmm. orthopedic surgeons, the total knee replacements, total hips, those are all postponed. Yeah. The surgeons are doing emergent surgeries, acute gallbladders, acute appendix maybe, but much less than their usual. And so everybody's not working at full capacity and wondering how long this will take place. And like I said, now we're starting to ramp up a little bit, but there's significant screening going on is who gets in the door, who gets to have surgery, who gets to come in for a checkup, kind of this stuff.
Right. Yeah. So was telehealth a part of your practice before COVID at all, or how, and then how like much do you see it happening in the future, even when patients are allowed back in?
It was not a part of the practice before, and then you wonder why,
Yeah.
It definitely will be part of going further. So some of it was insurance-based, cost-based too. People would show me a rash on Zoom, and it's like, okay, 8 out of 10 times, I'm nobody's dermatologist, but 8 out of 10 times you get people directed pretty well with the rash, but on the other hand, sometimes you need to see them in person. I think this will be a big part of it. There's going to be people who do not want to come in anyway, and it's going to be a while. Now, the fun thing was getting an 80 or 85-year-old or 88-year-old on FaceTime. They have no clue. They got to get their kids in or grandkids in to help them. Some of the visits we do and actually do an encounter visit by telephone. Well, I've been talking to people on the telephone, obviously, since day one, right?
Yeah.
Now it's like official. It's like we're making decisions based on the telephone. It's like I don't see them, so sometimes I'm not comfortable with what it is that we're diagnosing one way or the other. Yeah. But yet you can still give people good direction and go from there. And then you can sometimes have to figure out like who must come in as opposed to who can kind of wait and hang in there. Yeah. I think it will be very much a part of what we do in the future. I do.
Yeah, yeah, I can see that being a big change too. And then I guess, do you have any? I know you're no infectious disease doctor, but do you have any kind of like long-term predictions? I guess like a year, 5 years, decades down. Do you have any ideas on like how much this kind of will affect everything going forward? Maybe particularly towards your job.
Oh, good question. That's sort of the big question, really, nationally speaking. But I think it's going to be a slow return to whatever normal is. There's a big risk for a second wave, as they call it.
Yeah.
The vaccine is going to be crucial, and we know from flu vaccines, and I'm not comparing this to the flu at all.
Right.
The flu vaccine that we have every year, sometimes it's 70% successful, and sometimes it's 20% successful.
Yeah.
Is that going to be something true with coronavirus as well? There are a lot of people who refuse flu vaccines along the way, and people who don't vaccine, which is another discussion. But I think a lot of those people have come to see that vaccines are worthwhile, but it's like, how much credence are we going to put in this coronavirus? And then will it evolve over time? I think the new normal is going to be interesting to see. I just picture you go to Pfizer Forum and there's 18,000 people there. It's like, I want to do that. I want to go again. And all those kind of sports things, concerts things. I want to start that again, but people are nervous to be in big groups like that. And you wouldn't think of it before, but I think the washing hands, hopefully that'll be just part of our vernacular from now on.
Yeah.
And you would have thought it would have been before.
Right.
But really, it's something that we're conscious of now.
Yeah.
Same thing with getting away from people who are sick. There was a doctor on YouTube who talked about we all need to be out there because that's how we build up our immune system. And there's some truth to that, certainly. I agree with that, because keep people in a bubble. They're not going to have any immune status to fight things off.
Right.
Like, who's the person that we don't know about at age 35 who can't fight coronavirus very well? And you'd think that person would be healthy. Well, those are the ones you hear about on TV and on the internet. Even though 98% or whatever the number is, and I don't know the exact number, people have secondary illnesses, risks, that sort of thing. So it's evolving. In fact, my practice at 5:30 every day, Monday through Friday, we have a telephone conference for the doctors, and we update the numbers, and we have a fantastic doctor who's kind of running that show, and she is our expert to be sure, but she runs through all the numbers and compares Wisconsin to other states, and then any new protocols, any new recommendations, anything new that's coming down from national. We talked about the hydroxychloroquine, and now this new drug, antiviral drug, and where they're going to go with those. And so we're updated every night so that we keep up with what's
Yeah.
going on. That's very
Right.
helpful.
It's